Hi everyone, I'm Ashwin RajKumar presenting our research work Electrical Inhibitor for Tocolysis, co-authored with Drs. Jeffrey Karsdon, Frederick Naftolin, and Vikram Kapila from New York University. Childbirth before 37 weeks of gestation period is also referred as preterm birth, which is one of the leading causes of birth defects and mortalities in children worldwide. The annual expenditure towards preterm birth account for approximately $26 billion only in the USA. Some of the precursors of preterm birth are spontaneous labor, rupture of membrane, and induced labor. Although several preventive measures such as nutritional supplements and cervical cerclage are available, these patients are often given tocolytic drugs as a last resort that can delay childbirth for up to 72 hours. However, these drugs are harmful to the mother and child, thus they are withdrawn as early as possible. With around 10% of the children born preterm, effective methods are required for its prevention. The mechanical contractions of the uterine wall during childbirth are due to the electrical activity in the uterus. In a prior research by Dr. Jeffrey Karsdon, the benchtop device shown in the figure is used to inject current pulses on the uterine wall, which in turn stabilize the uterine contractions in other mammals and humans. However, multiple devices are required for conducting clinical trials to prove efficacy and commercial availability of the device. In this effort, we are motivated to develop a mechatronic and reproducible version of the electronic uterine control device for tocolysis. In addition to frequency, pulse width, and amplitude modulation, we wanted to design a battery-operable version for portability. In this slide, we delineate the electronic components in the mechatronic uterine control device being developed. The voltage from a battery is regulated to 5 volts that powers a circuit containing 2 timers for frequency and pulse width modulations. This in turn drives a current pulse generator for amplitude modulation. A microcontroller is also facilitated to measure the frequency, pulse width, and amplitude for providing feedback to the device user. The image shows a solderless breadboard version of the mechatronic uterine control device developed for prototype validation. The validated breadboard circuit is in turn assembled on a printed circuit board housed inside a 3D printed enclosure for clinical use and testing. The developed prototype is tested for current pulse generation. The picture to the right shows current pulses at 100 millisecond, 3 Hz and 17 milliampere amplitude applied on a 680 ohm resistive load. Load test with multiple resistors is examined to benchmark the newly developed device to the existing benchtop version of the device. The plot below shows that the newly developed device is capable of generating current pulses consistent with the existing device. Additionally, a low coefficient of variation indicates that the developed device generates repeatable current pulses. During normal pregnancy, mothers are with their family members. However, usage of a battery-operable EUCD requires patients to be admitted in a hospital setting for a longer period of time, which is expensive and takes an emotional toll on these patients. Internet of Medical Things is an umbrella term for connected health and monitoring devices. We propose an insertable electronic uterine control device with wireless charging and Bluetooth connectivity, allowing physicians to place the device and set it up so patients can stay in their homes and use the device. Internet connectivity of these devices will facilitate patient monitoring and alert emergency services when necessary. Thank you.